We've all seen on the TV a team's marquee player go down on the field and the commentators absolutely go off. And that these players just ended their season. You know, the age old saying, they've done their ACL, they're going to be out for 9 to 12 months. It's going to be a long road back for them. It's not uncommon, right, in sport and especially contact sport to see an ACL injury. So, hey, I'm Dean, I'm the owner of Fighting Fit Physio, and if you've had a recent ACL injury or you may know someone who has had one, then watch on and please share this video. There is so much emphasis that goes into the surgical rehab of an ACL within our elite population. And there's a huge crossover from that into everyday recreational athletes, weekend warriors, and just anyone within social sport even, that if they have a tear or a rupture or an injury to their ACL, they need surgery. So it's just become so routine that if we see this ligament torn, injured, ruptured on an MRI, that we head off to the orthopedic surgeon and we undertake an ACL reconstruction. But we don't actually need to. There's some really exciting new evidence that's beginning to become a little bit more mainstream that really kind of contradicts this need in many cases for an ACL reconstruction. So recent studies have demonstrated some healing capacity of the ACL with conservative management. And scarily, even some of these date back to 2011, which is crazy. Some other evidence suggests that the risk of OA may actually be greater in an ACL reconstructed knee than the non-ACL reconstructed knee, despite this injury to the ligament. And we also know that there's many top-level athletes at the pinnacle of their sport playing in NBA, NRL, NFL, EPL without an ACL. And that's, well, last time they probably checked, you never know, it may have grown back or healed. So why is this only just coming out? Why is it kind of mainstream? Well, routinely, many ACL injured patients just go, have their MRI, whip off for surgery straight away or within that kind of first 6 weeks period. And it's been long thought that this is the best practice for improved long-term outcomes and return to sport. Also, the ones that don't have surgery are rarely, if ever, re-scanned unless they have some kind of future incidents or injury to that knee. And guess what, for the first time ever, really over this year, last 2 years in the clinics, we've seen more non-operative ACL management of the ACL tear and rupture than we have operative management. And this is because a few people, especially in that recreation and social stuff, are going, hey, is this really the thing for me? And some of the professional athletes are even pushing towards conservative management. And why is this? Well, there's a quicker return to sport. It can be as little as 6 weeks and often up to kind of 4 months is the kind of mainstay. There's no painful surgery. There's a quicker return of normal knee function following injury. We don't have the effects of surgery like the atrophy and stuff to the muscle, so we get faster return of bulk and activation of the quadriceps and surrounding musculature through that kinetic chain. We have equal hamstring strength from injured to uninjured side than we do post-operative ACL reconstruction. So that functions back way quicker and way better. There's a lot less complications than surgery, so excessive swelling, pain, that kind of stuff. There's less impact on normal quality of life, quicker return to work, quicker return to everyday activity. So just normality of life gets back faster than it does post-operative. And also our quality of life score with a conservative management of ACL is far better than our operative side. So there is a few cases where surgery is required, and that's where there's concurrent meniscal pathology, where they may have a locked knee or there may be some ongoing clicking and so on and so forth, or there's some inherent instability within that knee and they're unable to return to normal function, normal sport, and so on and so forth despite conservative management. So conservative management can be great, but we've also got to monitor that long term, because if it fails to return to play or return to performance, then we may have to opt for surgery later on, and that may be the best outcome for the patient. So it's really an informed decision that the patient and yourself must make by weighing up the pros and cons of surgery and non-surgery. So you really want to get a good understanding, sit down and have a discussion with a highly trained, skilled clinician about the pathology in your knee and also understanding the function of your knee either pre-operatively or going into surgery. Because sometimes even if we just really well conservative manage that, then going into surgery is going to be so much better. It's a really good predictor of long-term positive outcomes if you have a good pre-operative phase. So ultimately, your mindset around overcoming the injury is really important. You need to put in the work regardless of whether you have an ACL reconstruction or you go down the conservative management route, and you've got to return the strength, the size of the muscle, the proprioception. You have to put in the work to get a good outcome regardless of which side you go on. So maybe you've suffered this, maybe you know someone that has, and hey, look, if it's a career-ending injury, you may want to just look at that, but if it's a season-ending one, definitely want to weigh up your options, especially now going into the off-season. It's really a prime time to look at how am I going to best manage this knee injury, especially around this hot topic of ACL reconstruction versus conservative management. All right, hope you got a lot out of this chat, and I'll see you on the next one.